Hello, everybody. Thank you for joining me today. This is Failure to Thrive, Suboptimal Weight Gain, and the Lactation Savvy Therapist, a webinar that I'm hopeful will be very helpful to all of you who are working with babies who are not gaining weight in an optimal manner. Before I tell you a little bit more about my background, I do have some disclosures. One is not financial. I am a member of my local breastfeeding coalition, Acadiana Breastfeeding Coalition, and financially I do receive royalties for the courses that I teach on the Lactation OT platform. Just to introduce you to me, my name is Jean Pishoff. I am an occupational therapist and an IBCLC or International Board Certified Lactation Consultant. So I am a pediatric OT, have worked in pediatrics for 16, close to 17 years now. And the bulk of my experience has been in early intervention. I've always done lots and lots of feeding therapy and have taken a big interest in that. And throughout the course of my career, started to niche down into infants specifically, where now the majority of my practice is devoted to babies, infants, usually under 6 months of age, who are referred for feeding difficulties. And I became an IBCLC because I recognized that there was a very big gap, or so it seemed to be, in knowledge from what I learned in OT school, which was nothing about breastfeeding, compared to what I felt like I really should know to be able to help families who were on a breastfeeding journey that was going a little bit awry. Because as an OT, I felt very comfortable with looking at the baby and assessing body issues, oral motor issues, but I didn't know a whole lot about mom. And so over a multiple year journey, about a 5 or 6 year journey, I obtained my certified lactation counselor credential, the CLC, as a stepping stone, to the IBCLC, and recently passed the exam to become an IBCLC in the fall of 2020. So I am currently working in a private practice by myself. I'm a solo private practice owner. And as I said, my primary clientele are infants with feeding issues. But I do see quite a few infants who are bottle feeding. And I'm also working some with toddlers and preschool age children who are having difficulties with feeding and transitioning to solids. So I was motivated to develop this course because a huge aspect of my practice is seeing babies who are having issues with weight gain and who are diagnosed or not, maybe meet the criteria, but aren't formally diagnosed with failure to thrive. And certainly as a therapist, before getting a lactation background, I didn't feel like I knew a whole lot about helping to guide families through weight gain issues. And so here we are. I'm hoping this is going to be very helpful for you. So we're going to cover our objectives today. Today in the webinar, we are going to cover how to identify optimal versus suboptimal or abnormal growth patterns for infants. And so throughout this course, you're going to be seeing a ton of growth charts. And these growth charts are from my actual caseload over the last year and a half or so of practice. I use growth charts a lot in my practice, especially looking at weight specifically, but we're going to delve into how to interpret them, some available apps to use so that you may do the same if you elect to do that in your practice, but how to identify what's a problem versus what's not when we're looking at that. We're going to describe characteristics of a baby who's not gaining weight in an optimal manner, because there are definite red flags that you can be looking out for. We're going to identify potential causes of failure to thrive or suboptimal weight gain. We're going to recognize the impact on family dynamics and maternal mental health when weight gain is of concern. We're going to identify strategies for supplementation to increase intake for the infant who is having a weight gain issue. We're going to discuss our role in this, the therapist's role in managing suboptimal weight gain, because we are definitely one member of a much larger team for these children. And we're going to identify actions that you might take if you are handling a sticky situation, a difficult situation when you're treating a baby that is not gaining weight.